my first question, this is one of their assignments. I call it the etymology of fat. Um, so fat, obesity, size, weight, how important is the language here?
I think that's a great question, and I think that's a big question.
Okay, so just out of curiosity, are you gonna
Yeah,
cut things and stuff? Because I
100%,
didn't
yeah.
prepare anything. I was just thinking, oh, we'll have like an organic type of
Well, that's what I hope for.
conversation.
I think language is really important.
The language is incredibly important, especially in the line of work that I do.
Oh, yeah, as a weight stigma researcher, I think language is really, really important.
Yeah. Well, the way I usually think about it is the language probably will vary depending on the context, who you're talking with.
I like person first language, which is a individual who has obesity.
I think language is really complicated.
When you're training future clinicians, the language matters not only how you conceptualize these topics in your own mind, but also how you apply them to your clinical cases that you do throughout your preclinical training, and then ultimately how you apply it to patients. And then it's incredibly important in the language in how you communicate with patients, which is arguably the most important component. So my name's Roshan Abraham. I'm an associate professor in the Department of Family Medicine, in the Faculty of Medicine and Dentistry at the University of Alberta.
I think, you really want to make people feel comfortable in their own skin, if you will. And it is a chronic disease, and people need to understand that this is not something that folks have done to themselves on purpose willingly. This is something that is genetic and they have to live with. And so we need to understand that from their perspective.
I am Dr. Sarah Nutter. I'm an associate professor of counseling psychology at the University of Victoria. So while I'm trained as a psychologist and I teach future counselors, my research is a little bit different. I focus my research on weight stigma and related phenomenon of body dissatisfaction and eating disorders, but mostly focused on weight stigma with a special interest in better understanding weight stigma as an equity issue, as well as better understanding the impact of weight stigma on health and healthcare. I think about the way language communicates who is in the in group and who is in the out group, who is othered by language. I also think about, from a health perspective, how is language used to label somebody as abnormal or diseased or pathologized? And I think about, it's how important it can be to feel like we have agency or control over the language that we use to describe ourselves and the language that is used to describe us. And so I guess that's a broad answer to a very complicated issue that people really struggle to agree on.
My name's Jeff Ball. I'm a professor of pediatrics at the University of Alberta in Edmonton. I'm also the associate chair for research for our department. Um, and I do research in mostly obesity management in children, some prevention, health services research, use a variety of different methods to answer questions that I think are, well, not just me, but that seem to be relevant in the field. It sort of evolved over time. I think in the beginning, this is when I say the beginning, it would be like early 2000s. I don't think there was much of a distinction. I think people would talk about obesity, and there were people that wanted to use the word obesity in these clinical interactions with families because it conveyed a level of seriousness that I think some clinicians felt like they needed to emphasize for families. Like they need to take this seriously. There are serious health issues related to it. Um, that I think has dissipated over time, and I think we take a much more in general, people are taking a much more family or patient-centered view of things and being able to have a conversation about issues related to weight and health. So sometimes clinicians will ask, what sort of words are there words that sort of rub you the wrong way? Or if we're here to talk about your weight and your health, like what are the things that what, do you like BMI, weight? And there will be families who will be like, no, you need to use the terms like use obesity, use heavy, use weight, use fat, like that's okay. I think that's probably less common than people who, I don't want to say dance around the topic, but they're more sensitive. They don't want to offend. And this is the thing that's very relevant in the clinical setting, is that if terms are used and they're not really thought through about, well, how might my patient or this family think about these terms? If an incorrect term or an insensitive term is used, and the way in which it's used, I think is also important. Like the general sort of feeling or the general state of the conversation will dictate the relationship. And when we talk about obesity, whether you think it's a disease or a risk factor for other diseases, it tends to persist over time. So if clinicians want to have a positive ongoing relationship with families and patients that they see, they should probably be mindful of the words that they're using when they talk about something like this. And we know that there's a lot of emotion, there's a lot of history for a lot of families. So we should be, as clinicians, should be mindful of that and respectful of that, so we can work together to help families.
When I started to hear from patients, when I started to hear from other colleagues in the space, it shifted my own perspectives of how to use language appropriately, and specifically how weight bias and stigma are ever prevalent in the work that we do in medicine. I think listening to others, specifically patients, but then also specialists, colleagues in family medicine, when you're surrounded by other people who recognize that this stigma is ever present, it forces that paradigm shift in your brain. When you're constantly surrounded by people who think of weight bias and stigma as almost second nature because of how entrenched it is within our medical education system and medicine, it's hard to get out of that. That's why systemic bias is so difficult to undo. It's not just about weight bias and stigma. All forms of systemic bias suffer from this.
So I'm Sylvia Santosa. I am a nutritional scientist at Concordia University in the Department of Health Kinesiology and Applied Physiology, and where I hold the position of full professor. So what we study is, the intersection between metabolism, obesity, and nutrition. So it's much more of a fundamental type of perspective, but we do a lot of translational work. Like all of our research is in humans. So it's very important to us to be able to actually interact and show our participants the respect that they deserve. And so it is important to get that language right when speaking with them. We want to make sure they feel included and they feel good about participating in our studies.
Basically, to answer your question, the terms are very important in and around pregnancy because they have a clinical meaning. Now, to the person, I think it's also really important, but it really depends on the person, where I would still say probably fat is less preferred. And just speaking objectively about weight or speaking about obesity and a chronic condition, if explained, is probably more preferred. So my name is Tanya Nightfall. I am currently an assistant professor at the University of Alberta with the Faculty of Physiology, Sport, and Recreation. In maternal health care in particular, I would say it's extremely important because in whether you're in preconception, prenatal, or postpartum care, weight becomes a central focus during that time. We use weight as a proxy measure for maternal health as well as fetal health. And then we also measure weight even after pregnancy as a proxy measure of if you're sort of coming back to your pre-pregnancy self. How okay is that? It's a whole other clinical discussion. But in terms of terminology use, they actually hold different meanings. So fat is not necessarily going to be like a subjective descriptor of a person. It could be about where is adiposity or body fatness on your body during that time, because that's going to impact things like type of delivery or how we do ultrasounds and whatnot. So fat is not necessarily used as just a descriptor of a person, but actually as talking about adiposity. Obesity, it's becoming more and more recognized in maternal health as a chronic disease. So that again is going to be different than calling somebody large or fat or more of a descriptor. Now we're talking about your metabolic health. Again, is that fully translated across all clinical care in Canada? No, but that is the direction that's going.
Oh, hugely important. Sure, I'm Jen Irwin. I'm a professor in the School of Health Studies, and I profess. I think it's important for so many reasons. When we talk about, like when you said fat to me, I'm thinking fat on a cut of meat, for example, because I don't use that language. Um, I think that the language around obesity has been socially constructed to have meanings that, by definition, these words don't actually have. And calling a person fat in our society is not like saying someone has brown hair or blue eyes. It's come to mean something unkind. And in some ways, it's almost become the last acceptable, although it shouldn't be, ism.
When you communicate with patients and use certain words over others, it prioritizes certain aspects of care over others and ultimately showcases weight bias and stigma when you preferentially use one term over another. And even something as simple, let's say, as the condition of fatty liver disease, which is and has been used up until about a year or two ago quite commonly and still needs to be changed. We've changed it to a more, I guess, stigma appropriate condition. And even conceptualizing that for medical students and residents and then communicating that to patients makes a world of difference when it comes to weight bias and stigma. And then ultimately actually understanding what the true treatment is for it instead of labeling it as a fat only disease.
Sure. So my name is Aaron Noga. I'm the board chair of Obesity Canada. It really stigmatizes people, whether it's here in Canada or, as I've learned, globally, right? There is a need to really put yourself in that person's shoes and understand from their perspective how damaging that language can be. And we've seen over the course of my tenure as a director, language change not only within the organization, but advocacy for language to change across Canada. And we've got some traction with respect to language, most recently with the government of Alberta and their recognition of obesity as a chronic disease.
For about 15 years, I was the director of an obesity management clinic at the Stollery Children's Hospital in Edmonton. I had a multidisciplinary team. We talked about this a lot. How do we talk with families about weight and health? And even people who talk about it every day, that is their job. Oftentimes, they still have a difficult time wrapping their tongues around the right sort of term. So, at least in my experience, when people talk about obesity in an academic environment or a research environment, the terminology is probably less important because we all have a shared understanding of more or less what are we doing here? We're working on a project related to obesity. We want to measure outcomes related to obesity. But when it comes to talking to children and to families, there, as you can appreciate, it's a different kind of conversation because there's values placed on size, there's sensitivities, there's histories, there's all these other factors that come into play.
So you do have to step outside of, I guess, your comfort zone. For me, I wouldn't say it's a comfort zone, but for a lot of people, it's a comfort zone because that's the environment that you've trained in. So being able to hear from others, talk with others, and then lastly, actually do the work. So for me, the work has been largely in education, advocating for changes at a large scale level with respect to curriculum changes, assessment changes in medicine, has forced me and allowed me to interact with a lot of like-minded individuals in the field, and as such has been able to not only challenge my own personal views around weight bias and stigma, but has allowed me to grow through self-reflection.
Right. But I think the first recognition really is to get people to understand it as a chronic disease.
Early in my career as a researcher, I defaulted to the word obesity. And while that didn't necessarily feel quite right all the time, it was really the only word I knew to use. But through my graduate research, I was exposed to diverse perspectives and critical perspectives and really appreciated how these other scholars helped me to broaden my perspective and consider my own use of language. And I felt like I came to a place of understanding this more deeply. And I shifted my language to be more weight neutral rather than shifting my language to the, I guess, opposite end of the spectrum to talk about fat. And the reason why is that the neutral language really felt like it fit for me from an inclusivity perspective. I felt like it included the most people if I used neutral language as opposed to the word fat, which not everybody is comfortable with and is still used as a pejorative. So, in certain circles of people that I know, maybe in certain articles I write, I might use the word fat in a, specific context where the people I'm with we're using that in a specific way, and we all know that. But I generally default to higher weight or larger bodies. And for me, what that communicates is that uh, all higher weight people experience weight stigma, but not all higher weight people have obesity. And I think that that distinction is really important. And not everybody makes it. And I find that frustrating. But that for me is the biggest reason why I choose to use weight neutral language.
Can I add to my answer?
Absolutely.
So I think that when we're referring to a human body, and if for some reason we need to be talking about its its features, its size features, then to me that's more of a clinical kind of thing, in which case I like person first language, which is a individual who has obesity.